The Pathways to Housing initiative, run by the Boyle-McCauley Health Centre in Edmonton, is being hailed a huge success, helping the chronically homeless off the street and into permanent accommodations. With us to shed some light on the 3-year-old program is Bob Hobrick, Program Director for the Pathways to Housing initiative. Good evening, Bob.
Good evening.
Welcome to Alberta Primetime. This program is part of Edmonton's 10-year plan to end homelessness.
Yes, it is.
What does it provide that maybe other programs don't?
The specific population that we deal with are people who have a history of chronic homelessness due to a serious mental illness. So I have a professional team that treats and supports the client in. We give them a home first. It's a housing first program. So.
And it doesn't end with just putting a roof over their head.
No, and I have about 8-member professional interdisciplinary treatment team that works with them in the house. The difference between us and traditional programs is that usually in traditional programs you get to be hospitalized or you get to, and housing is not a component. But common sense, I think, and it's also been evidence-based now, that if you give them a home, they have a higher chance of recovering and becoming stabilized in the community.
How difficult is it to maybe the word is convince? I'm not sure, but to get a person...
Not too difficult. Surprisingly, I think people really would like to have a home. Streets are mean streets, and it's not fun living there.
And it's not a challenge to keep them under one roof and maybe not drift back to a life that they know and understand.
Yeah, it's a challenge. I think that some people take longer to adjust to having their own home than others. One of the things that we're able to do is immediately address and stabilize the mental illness and stabilize income and stabilize the person in their own home. So we visit them quite frequently, about 3 to 5 times a week, and just really help them adjust into their own space.
Now this is being hailed a huge success.
It is.
Why? What makes it successful?
These clients are traditionally underserved by the traditional health system and social services system, difficult to engage, but are really high users and users of acute health care and other crisis systems like the police and jail and those kinds of things. And I think...
And that all costs money.
It costs a lot of money. And what we've been able to do, or what the success the clients have had with us, is that we've been able to retain 92% of the clients that have been admitted to the program. And we have... about 82% have remained housed with us. Some of them have difficulty in their first kind of effort at housing, so we just help them move on from that into another home, and basically about 82% are now sort of permanently housed.
So what's the biggest benefit there then? I hear dollars and cents, but is,
so do I.
But is that? It sounds like the program's paying for itself.
I think it's a benefit for the client, and yes, the program does pay for itself.
They're not now leaning on the healthcare system.
We've reduced visits to emergency room by over half. What we did was we took their health information and looked at 1 year before admission to the program and 1 year after admission to the program, and we have actually saved the system about $2.2 million, and our operating costs are $2.1 million. So we've paid for ourselves.
So you're just 3 years in. How do you build on that success? As maybe a final question.
Continue to do exactly the same thing. We're now up to 80 clients. And we continue to collect the same kind of data, and we're perfectly prepared to prove to anybody that we don't cost the system anything at all.
And you're setting an example of success for others.
We are.
Bob, very much appreciate your insight. Thank you for this. Bob Hobrick is Program Director for the Pathways to Housing initiative in Edmonton.